So welcome, 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 and thank you for being here because I am so passionate about eliminating chronic disease from the face of the planet, and I know I cannot do it alone. I can't, so I need your help, and I'm an ambassador for lifestyle medicine, and we're trying to get the word out. So I am one of these people. I did health education and health promotion when I did my master's at UCLA many years ago. So I love sharing the good news about what's possible in terms of your health. So I'm so thrilled that you're here. And we've got a great topic today because this is a really concerning topic. I mean, cholesterol is a very concerning topic. I had several people have already shared with me that they've got high cholesterols. You know, one person said their total cholesterol was 242. LDL 152, HDL of 56 with the triglycerides of 197. And the question is, what can I do? What can I do? And that's what this whole seminar is all about. Another person actually, well, I'm going to set the stage with this one because this is really detailed. This is somebody who has been following a whole food, plant-based, oil-free diet for 19 years. And yet, has LDL at 147 with the HDL of 59, and also has mast cell activation disorder. So there's a lot of questions around this and what's going on. And could all of this be related to the mast cell activation disorder? I'm going to answer that. We're going to get to that. So the lots of really great concerns are now. Please, I got to ask you all to mute yourself. I will mute you. Okay, very good. So we want to make sure that we're going to look at a lot of detailed stuff, but we're also going to look at it from a different point of view, really different point of view. So first of all, I want to share with you a couple of stories. My first introduction to cholesterol was back in 1981. So 1981, once I graduated from Cal Lutheran University in 1980, and then I went to work in the hospital at Los Robles Regional Medical Center, and I did everything in the lab. I was a lab rat, and I learned everything about medical technology. That was my backup plan in case I didn't get to go to medical school. And so then after a few months, I became a pathologist assistant. So I started working with the pathologist, looking at everything that came out of the operating room, and every specimen had to be examined. And then I also, I assisted on autopsies, a lot of them. I mean, a lot. And Dr. Glover was the senior pathologist. And he had been a pathologist almost for 20 years at that point, and he had been a surgeon before that for about 7 years. So he was extremely brilliant, knowledgeable, and he was an excellent teacher. He was very, very good to work with. I loved working with him, and he took me under his wing and gave me noogies regularly. No, I'm just kidding. I'm just teasing. But the thing is, he was really a great person to work with. I just loved working with him. And I remember because he taught me how to do the dissections. He really empowered me, and he was really getting me skilled. And I was doing the dissections of an aorta one time. And I started splitting the aorta, and it was, I said, Dr. Glover, what's that? He said, those are your cheeseburgers there. I stopped eating cheeseburgers. And then I remember one time I was dissecting the carotid artery, and I said, Dr. Glover, what's that? Oh, those are your hot dogs there. I stopped eating hot dogs. Well, you see, Dr. Glover was extremely knowledgeable about nutrition. He was one of the few physicians that really took it upon himself to really study nutrition on his own, because they don't teach you that in medical school. And so then he learned a lot, and he was a runner. He was very conscientious about his lifestyle and his health. And so it was extraordinary to work with him. And I learned a lot about what was going on. So I learned that I actually had the experience of cutting through those cholesterol plaques in the arteries, which are a lot like hardened beeswax. Now, you will never burn a candle and have the same experience ever again after today. All right, so the thing is, you will know that cholesterol is a lot like this waxy substance, and it's a very, very waxy substance, and it's just like beeswax. And that's what it really is like. So that was my first exposure. My second experience with cholesterol was a personal experience. So what happened for me in 1990, I ruptured my Achilles tendon while playing basketball. The doctor told me I would never play basketball again. I became depressed. It devastated me. And as a result, I stopped caring about my health and I started going to the junk food. And I went to the junk food for 4.5 years. Can you think about that? 4.5 years. They call it the dark night of the soul. For me, it was 4.5 years long. So the thing is, I did that. I mean, every afternoon, shortly after that, I went into healthcare administration, and I would leave my office and go up to the gift shop and get my package of 6 Oreo cookies. They're vegan, yeah. And then my king size bag of M&Ms, my large Mountain Dew, and my 3 Musketeers bar. Yeah, I put it all together every afternoon. That was my fix. Yep, every day. So I would do that. So in 4.5 years, I was 55 pounds heavier than you see me today. I had high cholesterol, 265, 270, total cholesterol. High blood sugar, it was climbing up 123. All right. I had high blood pressure. It was creeping up to 160s, over 100. Yeah, it was getting up there. Yeah, I had issues. I had issues and I didn't care. So it was just what was going on because I was depressed. I had so much stress going on emotionally and physically, mentally and spiritually that it was all adding up. And cholesterol was an indicator of what was going on inside my life. So those are my first experiences. So what I want to share with you today is what I've learned about being able to actually change your lifestyle and being able to actually have the indicator lights of the cholesterol, the LDL, all the different factors, all of those go back down into the normal range where they should be. But it's a lifestyle approach as opposed to an allopathic medical approach. In the medical approach, what I learned when I was in medical school was to see a problem and then fix it. All right, ladies, you will know that as the typical masculine approach. Yeah. Doesn't work, does it? All right. You know what happens. All right. There's, you tell your guy your problem and immediately he wants to fix it right away. He doesn't listen to you. He doesn't get the whole world of what's going on. Yeah. He doesn't listen to you at all. He doesn't get the whole context of what's happening in your life. No, he just wants to fix the problem and be done with you. Lifestyle medicine is a powerful masculine approach. Okay, because a powerful masculine can actually listen to the feminine and really get the whole world. You see, I've been an excellent salsa dancer for many years. And lifestyle medicine is about being able to embrace both the masculine and the feminine, put it together. It's a holistic approach. It's beautiful. It's wonderful. It's amazing. It's amazing. It really is. So I've got lots to share with you, and we're going to really dig down in terms of understanding what's at the root, what's underlying the indicator light of the cholesterol going up. Cholesterol, I will assert right here, right now, cholesterol is not the problem. It is a symptom. It is a symptom. All right, so we're going to look at that, and I'm going to share with you lots of information. So it's really, really great. Okay, all right, lots of good stuff to share. I'm going to get over to my PowerPoint presentation. Now, here's the thing. You're all muted. In the meantime, if you have questions, please post them in the chat window. I will not promise to get to them during the webinar, but I will definitely get to them at the end. So definitely keep that in mind. I will absolutely stay till everything is answered. That's my commitment, my promise to all of you. I want to be able to take care of you. I'm here to serve you. That's why I'm here. So make sure you do that. In addition, I want to let you know I'm recording this. I will send you the recording from today's webinar. In addition to that, I'm going to send you all the slides. Yeah, you're going to get all the slides that I use. So you don't have to take copious notes, just whatever you want to be able to take notes on. And then in addition to that, I'm going to send you all the resource information. So all the videos, citations, articles, everything. Everything I do is completely evidence-based. No weird stuff, no scams, no gimmicks, no sales, none of that, none of that. So you're going to get all that information. I will also share with you information about my services and what I offer. So you'll get that. You're going to get all that information in an email. I usually try to send it out by tonight at the end of the evening. So I'll do that. So that's what you're going to get. So hold on, here we go. So now what I'm going to do is shift over to my PowerPoint. So give me just a moment. I have to make a couple of clicks here. So I'm going to move this over here and click 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 here. Isn't it amazing what we can do with just a few clicks? All right. Okay, where are we? Let's see. Let's see here. There we go. And then move this over here. All right, I'm back. All right, so understanding cholesterol. So those of you who are nerds like me, this is a three-dimensional model of the molecule of cholesterol. Yeah, it is. So the black represents the carbon atoms, the gray represents the hydrogen atoms, and that red one is an oxygen. Yeah, that's the makeup of cholesterol. So if you were to put together a three-dimensional model, that's what it would look like. So my name, Ruben J. Guzman, MPH, does not stand for the speed that I drive my car, just so you know. All right, so it stands for Masters in Public Health. And I got that degree from UCLA back in 1988. And I specialized in behavioral sciences and health promotion. I loved my program. It was amazing. I got to work with some of the most brilliant people in the world. And when I got finished with my program, I had a very important decision to make. Do I or do I not return to UC Davis School of Medicine, where I'd spent 3 years studying to become a physician? My independent research is what led me into the field of public health. My advisor said, Ruben, you're onto something, but we don't have the resources here for you. You can go do your master's and then come back if you want to do that. So I did. I went to UCLA, loved it. And then I realized I was no longer committed to treating disease, and that I was completely and totally passionate about preventing disease and promoting health. So I made a bold decision to not go back to medical school and to follow my heart and to really study lifestyle medicine. But I was ahead of my time. There was nothing called lifestyle medicine back then. I went into healthcare administration because it seemed like the best job I could get at that point. So I did that for about a dozen years, but I kept studying on my own independently. I'm one of those people, I'm always learning, always growing. And so I studied about lifestyle medicine on my own. And in 2016, I went to the Nutrition Healthcare Conference. And one of the presentations was from Dr. Leon from the American College of Lifestyle Medicine. I was intrigued, I was fascinated, I was ecstatic. I said, oh my God, there's a new branch of the American Medical Association, and it's an evidence-based approach to prevent, reverse, and treat chronic disease. I'm in. I'm in. So I signed up, I registered, I went to my first lifestyle medicine conference in October 2017 in Tucson, Arizona, and it was fabulous. I walked into the room, there were 1,200 healthcare professionals, MDs, PhDs, 38 different countries. I thought I'd gone to heaven. It was amazing. I mean, we're all on the same page. The energy was palpable. It was amazing. I was like a bumblebee going all over the place, talking to Dr. Michael Greger, Dr. Dean Arnish, Dr. Caldwell Esselstyn, Dr. T. Colin Campbell. I mean, all these people, it was incredible. And they announced at that conference, the opening of board certification. So the first category for physicians, of course, MDs and DOs, but a second category for PhDs and those with a master's in a health-related field to be professionals, lifestyle medicine professionals. I'm in. I signed up, studied for a year. October 2018, went to my second lifestyle medicine conference in Indianapolis. And after the exam, I passed my exam. I loved it. And now I'm one of, in fact, my certificate, my number is number 81. All right. I'm one of only about 500 board certified lifestyle medicine professionals in the country. And it's really awesome. So lifestyle medicine is this evidence-based approach to prevent, reverse, and treat chronic disease using lifestyle measures. So we really focus in the areas of nutrition, physical activity, emotional well-being, alcohol and tobacco reduction, healthy relationships, hydration, and sleep. Consider these as the spokes to your wheel of health. And it's really important to recognize that you have to adjust all of these spokes, not just one. A lot of us have been brainwashed into believing that we've got one problem, therefore we need one solution. And that's the medical model, and it doesn't work. It doesn't work for chronic conditions. We have to look at all the spokes and adjust them accordingly. So that's lifestyle medicine. And yes, I am a certified professional with the American College of Lifestyle Medicine. In addition, I'm also a member of the Institute of Coaching out of Harvard as well. So I get to live into this quote that Thomas Edison said well over 100 years ago, that the doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. And doesn't that make sense? It certainly does to me. So I also want to let you know I have absolutely zero, zilch, nada as far as conflicts of interest whatsoever, none. All right, no products, no schemes, no gimmicks, none of that. All right, I'm an educator. I love to teach. I was a university professor. I've taught high school. I love teaching. I've been a coach for over 40 years. So I love teaching. And I do this for two major reasons. I do these webinars for free because, number one, I'm passionate about eliminating chronic disease from the face of the planet. And two, I believe in the power of paying it forward. To me, as adults, we all have a responsibility to leave this world a better place than how we found it. And that's important for our posterity. I've got 4 children myself, ages 34, 29, 22, and 20. So I know one day I'm going to have a ton of grandchildren, okay, if they're anything like me. So the thing is, so we got to take care of this planet, all right? And we've got to really ensure that they are healthy, really important. So that's why I do that. So that's why I also ask for your help, because I can't do it by myself. So my plea for all of you is to please share this information. I post this widely, I send out emails, share it with anyone and everyone, okay? Do not hoard it, all right? Just share it with everyone, because I believe that Virgil was correct when he said this well over 2,000 years ago, that the greatest wealth that any of us can have truly is our health, because without it, we don't have anything, all right? We've got to start with our health. So let me share with you the framework of what I'm going to cover today. So I've got lots of information to share with you. I'm going to talk about the context for health. I discussed this in many of my webinars and my seminars, but I'm going to really look at it from the standpoint of cholesterol. So we're going to look at that particular facet. In addition, I want to also look at the correlation between cholesterol and heart disease. And then we'll look at what cholesterol truly is. Most people don't know. They just don't. I asked them, okay, your cholesterol's really high. What is cholesterol? They don't really know. And have their doctors ever explained that to them? No, they haven't. So they just tell them, no, your cholesterol's high, you need to take Lipitor. Okay, that's all that they said. So we're going to then talk about 6 specific actions, lifestyle medicine actions that you can take to effectively reduce your cholesterol without medications. And guess what? As effective or better than the statin drugs with no side effects, none. And then also I'm going to sprinkle in some information about the research on successful reduction of cholesterol and cardiac disease risk. And then we'll finish up talking about how you can make the rest of your life the best of your life. All right, so we'll start with the context. And in order to do this, we need to be open to new ideas. I have many teachers, and by the way, I do not claim in any way, shape, or form to be the all-knowing expert about everything. That might be Michael Greger. He's a walking encyclopedia. It's certainly the opinion of that, it would be my father. He thinks he knows everything about everything there is to know. But no, I'm not the all-knowing expert. I'm just a student. I've been a student. I will always be a student. So I'm sharing with you all the time. And every one of my seminars, by the way, is always new. It's updated. It's upgraded because I'm always learning, always. So one of my teachers has some words of wisdom for you right here, right now, that I will impart to you. You must unlearn what you have learned. Okay, so I'm hoping you're willing to have an open mind, as Yoda suggests. So first, let's start with this conversation. Dr. Kalitsky said this to me many years ago, that remember, all of life is in one of two states at any given moment. Either it is surviving or it is thriving, and that's all there is. And when he said this, it perplexed me. And I asked, are you saying it's just one or the other, Dr. Kalitsky? And he said, that's exactly what I just said, Ruben. I said, Dr. Kalitsky, I'm thinking there's got to be a bell-shaped distribution curve here. And he said, no, it's one or the other. Of course, I'd just taken statistics. And I said, I'm not getting it. And he said, sit with the Ruben, you'll figure it out. I hated when he did that to me, and he did it often. All right, so I sat with it for 3 years. So my first year in medical school, I'm sitting in a class called embryology. So embryology is the study of the embryonic period of human development. From the moment of conception to where everything is there, now it just gets bigger. So if you're a mother, you know this period very well. It correlates with your first trimester, which you'll never forget. Most women never forget the first trimester. And so it's an amazing, miraculous period of time. It's incredible how the human body actually develops from just the sperm and the egg, and just, it's amazing. It's amazing. So early on in our development, we look like this, a ball of cells that are indistinguishable from each other. You can't tell them apart. We call it a blastomere at this stage of the game. But then the ball gets bigger and bigger, and then eventually it starts to fold inward, and then it starts to form this tube of cells. Now, this tube of cells will become the first organ system of the body to become distinguishable and operational. This tube is otherwise known as the neural tube. Yes, the neural tube. So the neural tube will give rise to what we call the limbic brain, which includes the hippocampus, the amygdala, the hypothalamus, the pituitary, and it's all connected to the spinal cord. Now, the professor said this is the central nervous system. Now, this is critical in understanding cholesterol. This is critical. It's absolutely critical. So I want you to really understand the connection here, because I'm going to really paint the picture here. So this is the central nervous system. It runs the show. It runs the body. It is the electrical system of the body, as the professor said. And just like any basic electrical system, it's got two currents. You've got a positive current and a negative current. So the positive current, whoops, where we go? This way. The positive current is referred to as the parasympathetic branch of the central nervous system. So when the positive current is on, it's on for the entire body, not just some of the organs, no, all of the organs. All of the organs. And when it's on, it's going to have an effect on every organ system and every cell in a particular way. Now, this is very important to understand when it comes to cholesterol. We're going to integrate this information as we go along. Now, that's the positive current. The negative current is referred to as the sympathetic branch of the central nervous system. When it is on, it is going to affect every organ system and every cell in an opposite way. These two currents, these two branches of the central nervous system, these two states are polar opposite of each other. This is critical to understanding cholesterol. Critical. So here's what happens. Here's what happens. When we are in the sympathetic state, it's affecting every organ system, every cell. We are reacting to physical, emotional, mental, or spiritual stress. Those are the 4 fundamental human energies. Now, a doctor will look at your cholesterol levels, but never will ask, how are things going at home? How's your life going? What's your stress levels like? How's your sleep going? Are you drinking your water? The doctors don't ask those questions. So what happens is that when we're in the sympathetic state, our body's reacting to stress. We're in the state of survival. So what happens is that we're going to actually absolutely, and I'm going to show you later the correlation, we're going to start producing, with long-term stress, we're going to start producing more cholesterol. Naturally, we'll just naturally do that because we need to produce more stress hormones. Now I'm going to show you the connection, how that works. We're operating from a primal state. So it's a very primordial type of a state. We're very primal. It's all about, fight, flight, freeze, or fold. All right, we're doing those. Those are the reactions that we notice. But even as subtle as a perceived threat is enough to trigger the sympathetic state. It's enough. Oh, I've got to get on a Zoom meeting with George. Oh no, I don't want to do that. Oh, so that's enough. Now, what we see in the literature is clear that the common thread of all chronic disease is being in the state of dis-ease far too much. Far too much, because our body is designed to be in the sympathetic state periodically for short bouts of time. That's it. That's it. Okay, you got to run and get away from the saber-toothed tiger. Okay, you're done. You're safe now. All right, you got to run real quickly, or you got to do this real quickly. So it's just short. That's what we're supposed to be able to be operating from. But when we have this prolonged stress, that leads to elevated levels of cortisol, which is a long-term stress hormone that goes along with it. And one of the things that I usually have people do is I have them measure their cholesterol, all the different variables, and their cortisol. Most doctors don't measure the cortisol levels. I always ask for them to do that. So when we're in the sympathetic state for far too long, it's absolutely going to drive cholesterol up. Absolutely, naturally, it's going to do that. Now, what we try to do in lifestyle medicine is this. We look at being able to fundamentally make a central nervous system shift. Because you can add Lipitor to a person in the sympathetic state. Will that change their central nervous system state? No, it will not. So what we have to be able to do is fundamentally shift the state of the central nervous system from sympathetic to parasympathetic. Now what happens is this: the body experiences peace, pleasure, restoration. It's digestion of food, fun, play, and ease. We're thriving, and the body heals itself more effectively than any drug could ever do. And we're operating in a powerful state. So this is what we have to be able to do. This is what lifestyle medicine is all about. Now, I say, and I've been saying it for years, that there are 5 major elements that we have total control over that influence which state we are in. Which state? So here is a summary of them. Okay, I have a whole webinar just on this, the 5 secrets to living a thriving, healthy, happy life. So number 1 are the thoughts that we think. You see, if we have stinking thinking, then we're going to trigger the sympathetic nervous system. If we have if we use the power of positive thinking, then we'll be in the parasympathetic state. Our thoughts are powerful. Second are the words that we speak, because if we're complaining, if we are gossiping, if we're being critical, cynical, skeptical, then we are absolutely going to be in the sympathetic state. So if we are being positive and encouraging and supportive and compassionate and loving, then we're going to be in the parasympathetic state. Now, not only is it the words that we speak, but it's also the words that we listen to. And this is why for over 35 years, I have not watched the news. It's the same thing every day. The third element is the actions that we take. And what happens for us as human beings is that we oftentimes, we make promises, not just to others, but also to ourselves. And when we let ourselves off the hook in that moment, we know we let ourselves off the hook and we put ourselves in the sympathetic state. So it really requires, as Dr. Stephen Covey talks about, being able to make promises and keep them. Mm-hmm. That is living a life of integrity. The fourth secret is the company we keep. And what we show in the research now, even more than ever before, is how influential our inner circle of 5 people, but even beyond, affects our health, our life in every single way. It's amazing. It's not only our friends and family members, but it's also their friends and family members. It's incredible. And then the fifth, which is the shocker for most people, is the food that we eat. Most people never think of food as being neurologically impactful, but guess what? Everything affects our central nervous system. Yes. Some foods, or food substances, I refer to them as food substances, because you can put them in your mouth and they may taste good, but quite frankly, they're going to stimulate the sympathetic branch of your central nervous system. So some things can stimulate a sympathetic response, where other foods can actually stimulate a parasympathetic response. We'll talk more about this later. In addition, in lifestyle medicine, we talk about these 7 areas as all being important to influencing your central nervous system as well. So hydration, absolutely critically important, because if you're dehydrated, guess what? You're in the sympathetic state. Nutrition, we talked about that. Physical activity, we're designed to move. And if we're not moving, guess what? We're in the sympathetic state. So we've got to move. Harmful substance reduction, we need to get rid of the alcohol and the cigarettes and the caffeine, because all of those are harmful, all of them. Sleep, critically important for our life. We're going to talk a little bit about that. Emotional well-being and stress management, absolutely critical when it comes to cholesterol. Be sure to check out my Stress Management 101 seminar. I've got a whole bunch of other material, my healthy relationships, communication for a peaceful life. All those things are important when it comes to our emotional well-being. And then healthy relationships, absolutely important. And that's coming up in 2 weeks. I'm going to talk about creating healthy relationships. Don't miss it. It's on Valentine's Day. The best Valentine's present you can give is my webinar on Valentine's Day. It'll be awesome. It'll be awesome. So now let's get to the heart of the matter. What about cholesterol and heart disease? Is there a connection? Well, we're going to talk about that. So what we see in terms of the stats on heart disease, so 20% of heart attacks that are silent, people don't even know about them. 18.2 million Americans aged 20 and older have coronary heart disease right now. It's the #1 leading cause of death for men and women in the United States. This last year, COVID has been compounded on this as well. 647,000 deaths, number of Americans who die from heart disease each year. And 80% is the percentage of preventable cases of heart disease and stroke. Absolutely, at least 80%, if not more. Now, when we look at the numbers on mortality, this is 2015, 2016. So we see heart disease. I'm going to also include stroke here. So we see heart disease up here, and then we see strokes. Those are definitely vascular. Diabetes related, Alzheimer's is related as well. All right, so those are all vascular related diseases, and cholesterol is a factor. This chart got updated, and so what we see, it still is the same case. All right, so we see heart disease, we see stroke, and we see diabetes and Alzheimer's. So we see those very, very high in terms of the mortality. This last year was very interesting because I saw this graph. this is what we see. Deaths attributed to other causes above normal in 2020. Not only have we been dealing with COVID, but diabetes has been 15% above normal mortality. Alzheimer's disease, 12% increase in mortality. High blood pressure, 11% increase in mortality. Pneumonia and flu, 11%. Coronary heart disease, 6%. Stroke, 5%. Sepsis, 4%. Kidney failure, 1%. So we've seen a lot more complications in the chronic diseases. Part of my research that I started many years ago was looking at the geographic distribution, what we call epidemiology is part of that. And when we look at heart disease mortality in the United States, here's the graph of the distribution of mortality rates due to cardiovascular disease in the United States. And what you'll notice here is that the greatest concentration is over here in the southeast portion of the United States. So the Mississippi and Ohio Valley and that whole area is the highest concentration of mortality due to cardiovascular disease. When you look at stroke, what we see, the chart, again, the darker the purple, the more cardiovascular disease. So this is shocking to see. So we see a lot of the mortality there. Alzheimer's, another, we've also been seeing, be sure to check out my Alzheimer's webinar, because we see that there's a cardiovascular component that's definitely at play, because cholesterol gets oxidized. The oxidized cholesterol has been shown to be much more prevalent in the plaque of the arteries of the brain in Alzheimer's patients. So it's definitely a component. So we see that again in the southeast portion of the United States. And then when we look at diabetes, we see the same picture as well. So we're seeing that in the southeast portion of the United States. In addition, we also know from the research that obesity plays a significant role in terms of contributing to chronic disease. Not only cholesterol being high, but also obesity being high contributes to chronic disease complications. And again, this whole part of the country is the highest in obesity prevalence in the United States. When we look at mortality, the 10 states with the lowest life expectancy in the United States, here pictured in red, happen to be geographically all next to each other. That's fascinating, isn't it? Yeah, unexpected. So the 10 states, in case you forgot your geography: Oklahoma, Arkansas, Louisiana, Mississippi, Alabama, Georgia, South Carolina, Tennessee, Kentucky, and West Virginia. This is interesting. So could lifestyle factors be at play here? Could lifestyle factors be at play here? Well, let's take a look. One of the areas of lifestyle is nutrition. So let's look at what are some of the factors that contribute to nutrition and chronic disease. One would be fat consumption. We're going to talk more about this later, but let's look at a popular food export from Kentucky, Kentucky Fried Chicken. And the consumption of Kentucky Fried Chicken in the United States, notice it's the same distribution in terms of the concentration there. All right, let's look at physical inactivity, because when you don't move, it contributes to chronic disease. All right, we've got to move. And so when we look at the chart from the CDC, we see that physical inactivity again is highest in the southeast portion of the United States. All right, let's look at frequent mental distress. This one was shocking. So we see again that frequent stress is the highest concentration in the southeast portion of the United States, and interestingly enough, Fresno. And if you've been there, you know why. Okay, so the thing is, and then sleep is another major factor, because look here, southeast portion of the United States, nobody's sleeping in Georgia and Kentucky, I'm pretty convinced. All right, they're just not sleeping there. There, and also Las Vegas. Okay, so the thing is, sleep absolutely contributes to a shorter life. My friend, Dr. Stephen Loam, he's a cardiologist. I'm going to send you a couple of his seminars that he's did. And he talks about that there are 5 major factors that keep us as Americans, keep us sick. So one is being in the sympathetic state on an ongoing basis, because the way our brain is wired, when we're in the sympathetic state, we are going to avoid pain, seek pleasure, and conserve energy. That's how our brain is wired, and that doesn't contribute to health. A second factor is our family lifestyle behaviors. A lot of people say, "Oh, heart disease runs in my family, so therefore it's genetic. I'm going to get it." And we think that. "Oh, high cholesterol runs in my family, so therefore I'm doomed. I'm going to get it." And we think that, and it's a myth. It really is. It's not necessarily the case. Now, there could be a genetic factor to it. There could be, and we'll talk about that a little bit later. But the thing is, chances are your family's lifestyle behaviors have been passed on. Another factor that keeps us sick is the food industry. Now, do you think for a moment that the food industry in this country, and you've seen their ads, do you think that their number one priority is your health? Think again. And then another thing that keeps us sick is our government. Our government is really not placing public health at the priority that it really has needed to be. We have a history of really problems. We have a lot of problems when it comes to health and healthcare. I mean, there are so many other industrialized countries that fare so much better than we do in terms of quality of health and quality of life than in the United States. And then another factor that really contributes to us being sick perpetually is the medical industry itself. Now, I will tell you this, having been inside the belly of the beast, physicians learn next to nothing when it comes to nutrition in medical school. I had a whopping 10 hours. And what we studied, the first half of the class, were the nutritional deficiency diseases: kwashiorkor, marasmus, beriberi, scurvy, which we haven't seen in 100 years. It was ridiculous. The other half of the class, we studied all the micronutrients, all the vitamins, all the minerals, and that was it. That was the course. Nothing practical, nothing applicable to chronic disease whatsoever. And in fact, the book that they gave us was actually provided for us, truth be told, by Upjohn Pharmaceuticals. Do you think there's a potential conflict of interest there? Maybe. On the medical school board exam, about almost 70 questions were directed towards organic chemistry and pharmacology. Only one question on nutrition. That was it. So the thing about it is that we have a system that perpetuates us as Americans staying sick, and it's costly. It's very, very costly. According to a study published in the American Journal of Managed Care, the average cost per patient with established cardiovascular disease were nearly $19,000 per year. So if you're alive with cardiovascular disease, you got high cholesterol, high blood pressure, any of those things. All right. Now, the cost per heart attack exceeded $100,000 per patient. Costs were substantially elevated for those with other conditions, so that if they have comorbidities of diabetes, chronic kidney disease, or depression, cost is even more. So it's expensive. Lifestyle medicine chooses to take a different approach. As Dr. Wayne Dysinger, one of the founders of the American College of Lifestyle Medicine, says, lifestyle medicine is the foundation of healthcare, because 80% of healthcare is chronic disease right now in the world, in the United States especially. 80% of chronic disease is lifestyle. It's caused by lifestyle. So if the disease is caused by lifestyle, the foundation ought to be a lifestyle treatment, not a drug. Doesn't that make sense? It certainly does to me. And that's why I'm so excited. So now let's take a look. What's the correlation between cholesterol and heart disease? So that was a question that was raised back in the 40s. So in 1948, a study was begun in New England called the Framingham study. Now, what they did is they wanted to look at the relationship between cholesterol and heart disease. So it started in 1948. And what they showed is that those people who had cholesterol, total cholesterol of less than 150 had the lowest risk. And they also noted when they looked at international epidemiology studies that people in rural Asia, Africa, and Latin America, their cholesterol ranges were usually between 125 to 140, and these places have the lowest risk. In fact, there's places there's a place in Africa, there's tribes in Africa that they don't have any heart disease whatsoever. None. All right, so there's places in the world like heart diseases, that doesn't happen. So it's really interesting. So in Framingham in New England, what they did is they started to look at people over a long period of time from 1948 to 1974. So they looked at people over the course of these 26 years. And so what happened was this, it's very interesting. Now, they didn't show us this in medical school, but it really is interesting. I've since learned about this. So when they looked at the people who had coronary artery disease, CAD, coronary artery disease, and they looked at their cholesterol levels, we got this red line here. So that's the graph of the distribution curve of the people with coronary artery disease. But you'll notice that there's a fairly significant overlap with the people who have no coronary artery disease. So their cholesterol levels are on this curve. So that's the graph of their distribution of cholesterol. So there's quite a bit of overlap between the two groups. It's not a clean separation between the two. So it's interesting. So what they did, based on all of this research, the medical community said, okay, since there's no clean demarcation between these two groups, what we're going to do is we're going to just mitigate and reduce the risk. And we're going to say, okay, those with cholesterol levels of less than 200, since that's only 20% of the group with coronary artery disease, we're going to say that that's okay. You're fine if you've got a cholesterol level of less than 200. So they established that back in the 70s. And they said that. So a lot of times for years, you would go to your doctor and they check your cholesterol. Oh, you're below 200, you're fine. And they would say that, but not necessarily the case because we didn't know enough. We didn't have detailed enough information. Now, when I was medical school, we also talked about, and I mentioned earlier the dissections that I did, we mentioned that we saw that cholesterol was a contributing factor of these plaques. So when we looked at the anatomy of these plaques, what we saw that they were filled with lots of things, including quite a bit of cholesterol. Like I said, it's this beeswax consistency type substance. And it will sound like that. All right, you can actually hear it. So we started seeing that, okay, these plaques are caused by these cholesterol plaques. So cholesterol is being deposited on these arteries. Now, if we look at a cross section of this diseased artery that's got all this plaque, then what we notice is this, that we see a healthy artery on the left. Now we see this gray area here in this big opening. That's what we call the lumen, or the area where all the blood cells would flow through. Now, we also see this thick red, kind of a dark red area, and that is the muscle wall of the artery. Notice how nice and thick it is. That's really, really good. And we like to see that. Now, there's also this very thin, very dark red, almost brown lining. All right, that is the endothelium. I'm going to talk at length about this in a minute. All right, very important to understand. So this is a healthy artery. This is what it looks like under the microscope when we do a dissection, cross-section of it. On the right is a diseased artery. Now, a diseased artery, this opening that we see over here has been reduced to this little hole opening right there. So this is about, we probably call that about 98% occluded or blocked. And also notice something very important, that the muscle wall, that nice muscle, because that muscle is what allows the artery to expand and contract. but that muscle wall has been wiped out. It's so thin, it's like next to nothing. It's like PVC pipe. It's very stiff. And all of this is the plaque, all of this in the middle. And it's got cholesterol and it's got all kinds of foam cells and all different kinds of cells in there, all kinds of stuff. It's a mess. It's an absolute mess. And it's very stable. It's very stable. Now, what happens is this, that the area of concern to really evaluate is this inner lining called the endothelial cells. The endothelial cell is this one cell thickness lining of the blood vessel walls. Now, here's what happens. Endothelial cells are very delicate and very sensitive, and they need to be taken care of very well. They produce nitric oxide into the blood vessel area that allows the blood cells to flow nice and fluidly without getting stuck to each other. It's beautiful. They have an incredible function. The endothelial, amazing. Endothelial cells are the same kind of cells that you have on the inside of your mouth. So yes, take your tongue, wipe it along the inside of your cheek, yeah, you feel that? Nice and slick and smooth. Very, very nice. Very nice. Those are endothelial cells. Now in your mouth, you've got about 8 to 10 layers thick of endothelial cells. So it's fairly thick. But I'm sure you've had the experience of biting your cheek at some point, and 2 minutes later, you did it again, right? What's up with that? It always happens. So the thing is, then you bite, once you've bitten your cheek, right? You bit your cheek and now your tongue is nursing that area. And you notice that it's what we call indurated. It's swollen and it's tender. And that is an area of inflammation, but you can feel it in your cheek. Why? Because you've got nerve endings, lots of nerve endings in here, lots of them. And you can feel it. Your skin is very sensitive. We got all these sensory nerves. So you can feel that in your cheek. You cannot feel it in your blood vessels. There's no sensory innervation to the blood vessels, none whatsoever. So what happens is this, that if we have the wrong diet, if we have stress, if we're in the sympathetic state for a prolonged period of time, no matter what, we can have pockets of inflammation that get started to form on the blood vessel lining of this blood vessel wall. So we get this pocket of inflammation that starts to form. And now here's what happens. If it's stable enough, then what our body is going to do, it's going to try to patch that. And so what it's going to do is use the LDL cholesterol, which functions as a dump truck. So when we've got inflammation in the body, we are going to increase the LDL, which is a low density lipoprotein, so that we can have that dump truck dump more cholesterol, which is this beeswax, to coat this area of inflammation and to stop it from rupturing. So we're going to try to coat that with cholesterol as a Band-Aid. So cholesterol will serve as a Band-Aid to an area of inflammation when there's inflammation going on in the body. Like I said, cholesterol is not the problem, it is a symptom. So now we've got this pocket of inflammation, but if we don't get the LDL cholesterol dumping enough cholesterol to patch this area up, then what happens, it becomes a wound that starts to open, starts to peel open. And so this pocket of inflammation peels open, and then we start to form a little bit of a clot. And then if it flips all the way open over here on the right, now we end up with what we call a thrombus or a clot. If this happens in a coronary artery, we end up with a downstream heart attack. That area downstream of this blood vessel will now not be getting any blood, any oxygen, and it starts to die. All right, so that's what happens in a heart attack. Now, the canary in the coal mine, to help us to recognize that we are at risk because there's more inflammation going on. So in the coal mines, they used to bring canaries down into the coal mines to make sure that there was enough oxygen. Because if the canary stopped singing, that meant oxygen levels were getting dangerous. The gas was getting dangerous. We needed to get out quickly because canaries are much more sensitive than human beings. So the canary in the coal mine when it comes to our bodies is erectile dysfunction, because the area that has the highest concentration of endothelial cells is going to be the sexual organs of the body for both men and for women. Okay, so it's the highest concentration of endothelial cells. Now we rank #1 in the world in erectile dysfunction, and it's 40% of the men over the age of 40 and goes up from there. With erectile dysfunction, that leads to a 500% risk of cardiac episode and early death. So it's definitely an indicator light. So we need to be paying attention to that. Any doctor that is prescribing Cialis or Viagra should also be doing a full workup, a lifestyle medicine workup. I'm really convinced of that. It's not survival of the fittest, my friends. It's survival of the firmest. Yes, so eat the carrots, stay away from the sausage. All right, so the real cause of heart disease and cholesterol going up is going to be this persistent sympathetic response in the body. It's acidification of the bloodstream, inflammation of the endothelial cells, and it's caused by acid-forming sympathetic foods and stress of any kind: physical, emotional, mental, spiritual stress, those 4. All right, that can be going on. Now, what is cholesterol? So this is a question that gets asked all the time. All right, so here again, this is the molecular model for cholesterol. What is this? What is this? You go to the doctor and you ask, well, my cholesterol, the doctor tells you your cholesterol is high. And you ask the doctor, what is cholesterol? They usually don't have much of a response. So I want you to know today the truth about cholesterol. This particular compound, it's a very particular type of compound. All right, it is the parent, it's the grandmother of all the steroidal hormones in the body. That's what cholesterol is. That's what cholesterol is. And we manufacture what we need. The central nervous system dictates that. I'm tying it back together here. Now, cholesterol is the parent compound from which all the steroidal hormones are derived. We cannot have all the steroidal hormones. Here are the steroidal hormones. Here are all the steroidal hormones. Now, if you studied physiology and you studied all of this, then you would know that this is how it all goes. So cholesterol up here in the upper left, this is the master molecule. It is a steroidal. Okay, and then we've got all these compounds that are derived. So we have this aldosterone is a water regulation hormone. We've got other kinds of hormones that get to there, including the sex hormones, pregnenolone and progesterone. We also have this branch here that leads to the development of cortisol, which is your long-term stress hormone. And then we have the sex hormones as well. All right, dihydrotestosterone, estradiol, testosterone. All right, all of these compounds are regulated by the central nervous system. They are all regulated. This is a completely regulated. You do not need to eat any cholesterol whatsoever, none whatsoever. This is all regulated. These are all manufactured internally, automatically through the central nervous system. So we have this entire intricate system. I'm not going to teach you advanced physiology today, but I want you to realize with this graphic, the hypothalamus, the anterior pituitary, the adrenal cortex, they're all talking to each other. And your circadian rhythm has an impact, your stress has an impact, and they're all going to manufacture, all the different things regarding your immune system, your liver, your muscle, your adipose tissue are all influenced by all of these hormones. All of them, okay? It is an incredibly complex system. Now you try to go to an endocrinologist and they're gonna try to give you medications to try to deal with this. It's not a good idea. It's not a good idea, All right, so what we want to realize is that when we have these steroidal hormones, they interact in the body in a very different way. Now you can add on the right-hand side is a non-steroid hormone action. For instance, you add insulin, it's a non-steroidal hormone. Okay, you put that in and it's going to lead to a message to try to get more energy. So we've been treating diabetes by adding more insulin in, even though it's not caused by a deficiency of insulin. We've been trying to mitigate the high blood sugar by adding in a non-steroidal hormone. But when you add a steroidal hormone into the mix, now you're asking for problems. You're asking for it, because what we end up doing on the left-hand side is that that steroidal hormone enters into the cytoplasm and interacts with our genetic material inside the cell, leading to the development of new proteins. So it leads to new structural changes in the body. This is why when people are on steroidal medications, it has all kinds of side effects, all kinds. So it's tricky business when we're talking about steroids. It's very, very tricky. And all the cholesterol is a steroid, and it is the grandmother of all the other steroids. There are lots of side effects from having too much steroid in the body. And this is what happens when anybody is eating any animal product. Any animal product whatsoever is filled with steroid. It's filled with cholesterol. All right. And there's side effects from having cholesterol in the diet. And you can look at this list, because this is what every sick person in the United States, we got 70% of the American population overweight or obese. We've got the highest rates of chronic disease on the face of the planet. And look, here are the symptoms. This is like a whole laundry list of all the things that we see in so many people here in the United States: acne, blurred vision, cataracts or glaucoma, easy bruising, difficulty sleeping, high blood pressure, increased appetite and weight gain, increased growth of body hair, hirsutism, insomnia, lower resistance to infection, muscle weakness, nervousness, restlessness, osteoporosis, stomach irritation or bleeding, sudden mood swings, swollen puffy face, water retention, swelling, worsening of diabetes. That sounds like a typical general practitioner's office day. That's what they're dealing with every single day. Every day. I talked to some of my colleagues. I said, how often do you see these things? He said, every day. Every day. Family practitioners see this all the time. All the time. This is typical. So here's what we do in the medical world. In the medical world, what they say, okay, you got problems, you got high cholesterol. What we're going to do is we're going to give you a statin drug. We're going to give you a drug to stop your liver from actually producing cholesterol that it's normally supposed to be able to create, because that's what your central nervous system does. So we give you statin drugs, but there are side effects. This is right from the Mayo Clinic, all right? Muscle pain and damage, liver damage, increased blood sugar or type 2 diabetes, cataract formation, memory loss or confusion. Does that sound good? I don't know about you. It doesn't sound too appealing to me. Not at all. So remember this, my friends, that the pharmaceutical industry does not create cures. Never has, never will. It creates customers. That's what it does. And that's the medical industry. Medical and the pharmaceutical industry are like this. They're like this. Now, here's the reality. The reality is this, that the dietary requirement for cholesterol, how much cholesterol do we need in our diet? Absolutely. Well, here's what the USDA says. The USDA says, oh, it's okay to have 300 milligrams a day or less. That's what the USDA, US Department of Agriculture. The American Heart Association says, 200 milligrams a day or less is fine. It's just fine. But you got to look at who's paying for their funding. The physiological nutritional requirement for cholesterol is absolutely zero, zilch, nada, nothing. Our central nervous system is in charge of taking fats and manufacturing cholesterol based on what our metabolic needs are. And we don't need to mess with that design. It's designed beautifully and it works really, really well, provided we stay in the parasympathetic state. What the problem is that when we're in the sympathetic state far too much, things go haywire. That's the problem. The cholesterol is a symptom. So understanding this, when we look at the blood values, we have to understand that everybody looks at their cholesterol numbers. They look at total cholesterol and they look at LDL and HDL and they say, oh, the good cholesterol and bad cholesterol. It's a little bit more complicated than that. So there's cholesterol carriers. So LDL refers to low density lipoprotein. So it carries the cholesterol. It carries that molecule of cholesterol. So you, like, again, you think of it as a dump truck. It's a dump truck. So what the LDL, when we got high levels of LDL, it's indicating that we've got higher levels of inflammation, attacking those endothelial cells in the blood vessels, all right, all over the place. So increased level means increased risk. Now, things that trigger higher LDL levels include smoking, stress, fat, cholesterol foods, many other things. Stress of any kind, remember that. Now, what we've since been looking at in the years since Framingham, we've been able to identify that there are what we call the LDL particles. So there's different sizes. So there's the larger ones, which are not as problematic. You can still increase your risk of heart disease, but the small LDL actually are the most problematic. So LDLs 3 and 4. So those are the ones that we see a much more significant, about 144% increased risk of cardiovascular disease with the LDL 3 and 4. And I'm going to talk more about that later. Now, what we've been able to show, that what I showed you the graph of the Framingham study, that total cholesterol was, there was so much more of an overlap. But when we look at LDL, and this was published in this, let's see, it was in Circulation, so cardiovascular circulation back in 2004. So what we were able to show back then clearly is that LDL, if you were to look at one factor, one number, it would be your LDL. So what we want to be able to do is we want to reduce your LDL. The relative risk of coronary heart disease goes up logarithmically. So what we're trying to do, I always try to tell people, we're looking to have the LDL less than 100 definitely, but target closer to 70. So we want to get it down in this lower region. People that have cholesterol, LDL cholesterol levels well over 100, it's definitely going to increase the risk. So that's what we see. However, there is still a genetic component that can be there as well. There is such a thing as hypercholesterolemia. And you could be following a tremendously healthy lifestyle and your LDL could be higher and you probably have higher HDL as well. So we have to look at the balance and the ratio and all those things. It's very, very complicated. There's a lot more to it. All right, now, the other carrier is the HDL, so high density lipoprotein. So think of these as being garbage trucks. So the more of these, the better. So we want these, we want to have enough of these because we want the garbage trucks to go around picking up all this cholesterol and the plaque. And if we got enough HDL and we really improve our lifestyle, the HDL will go up and then it will absolutely help to clear the plaques in the blood vessels, which is a beautiful thing. It's amazing. So we can clear those plaques. So we want to be able to do that. So exercise, vitamin C rich foods, fruits and vegetables, all that stuff. Very, very great. Great stuff. So think of it this way. Remember this, my friends, that elevated cholesterol is your check engine light. It's not the problem. It's not the problem, but it's a check engine light. And you want to be able to do a thorough evaluation. This is what lifestyle medicine is all about. Lifestyle medicine, what I do with people in consultations, I look at everything. I look at all the spokes because you can't just look at the problem and say, oh, I got a problem. I got this is high, this is elevated, and I want to fix that. No, not so fast. Let's look at all the spokes that contribute to your lifestyle because there could be a lot of different things that need adjusting. So we want to look at that. It's your check engine light. All right, so now let's dive into 6 major actions from lifestyle medicine that can help you to lower your cholesterol, particularly your LDL, and especially the LDL small particles, 3 and 4. So we want to be able to do that. Now, number 1 is a no-brainer. It's if you got high cholesterol, stop eating it, okay? All right, it's a no-brainer. All right, so if you're eating cholesterol, any animal foods, okay, meat, dairy, fish, eggs, all of that, that's all got cholesterol in it. It all does. So stop putting it in your body. So 100 milligrams of cholesterol in your diet will lead to a 5-point increase in your total cholesterol. So that's just 4 ounces of beef, chicken, or fish, a half of an egg, or 3 cups of milk. All right, that's enough to increase your cholesterol by 5 points. 1 serving. All right, that's 1 serving. All right, now plants have no, zero, zilch, no cholesterol, none whatsoever. If there was one reason to choose going to a plant-based diet, this would be it. All right, so there's no steroidal impact, no impact on the central nervous system, none whatsoever, okay? When you eat animal foods, it's going to be a drug interacting on your central nervous system and trying to adjust for this sudden onslaught of more cholesterol in the bloodstream, and it has to manage it somehow. So that's really important. So a 1% decrease in cholesterol leads to a 2% decrease in risk. So we want to be able to do that. So here's just to show you graphically. All right, so meat, this is, a small amount of meat. Chicken is about the size of a deck of cards. That's enough for 3 to 4 ounces, half an egg or 3 cups of milk. All right, and so that's number 1. Just decrease all cholesterol in your diet completely. It's a no-brainer. Now, the second thing that contributes to cholesterol being elevated is going to be fat. All right, in particular, saturated fat. All right, so we want to decrease fat. Saturated fats in particular cause the liver to increase cholesterol production, because I'm going to show you in a little bit, it's the only thing it can do with it. So all animal foods, again, all right, palm oils, palm kernel oil, coconut oil, all vegetable oils, all right, very much so cause an increase of the saturated fat. They're 100% fat. And especially if it says hydrogenated oils or partially hydrogenated oils, stay away from those. Those are just like, oh, no, don't do that. Don't go there. All right, so you want to make sure you stay away from that. So that includes all oils. I don't care what kind. If it's virgin olive oil or extra virgin olive oil or extra virgin olive oil, it doesn't matter. All right, no oils. They're all 100% fat. And it's even worse if you're dealing with foods that are fried in oil. I don't know where we got this idea that it was a good idea to take food that's perfectly good and then roll it up and soak it up in a fat jacuzzi for a few minutes and concentrate the amount of fat on that food. It doesn't go well. The actual data and the research on oils is this, that when we have oils in our diet, it decreases artery endothelial function. They don't function really well. Decreases flow-mediated vasodilation, the ability to expand or contract. Increases the triglycerides as well. One of the major reasons why triglycerides goes up is because of processed foods, especially with oils in them. Decrease oxygen transfer. When we have oil in our diet, we can't transfer oxygen from the blood cells into the tissues as well. Sympathetic response, we know that's not a good idea. Increased inflammation, that's going to injure the blood vessels and lead to dumping of cholesterol and creating those plaques. So that's the research on oils. No, it's not, this doesn't look any good at all. Doesn't look any good to me. So Dr. Esselstyn, who I'll talk more about later, he says this, I'll invoke his spirit here right now. No oil. I hope you get the message, okay? He says it just like that. All right, so I just want you to really get the message. No oil. All right, now another major source of saturated fats is going to be all your meats, including beef, pork, poultry, fish, and eggs, especially the processed meats. Those are really problems. Think of it this way. Guys, if you're out there, think of it this way. That food is your erectile dysfunction starter kit. Yeah, that's not working for you. No, it isn't. So meat by day, impotence by night, don't do it. Don't do it. All right, I love this slide. All right, and then eggs. I've had people tell me, oh, I'm trying to be a vegan, trying to be a vegetarian, but I have my eggs every day. No, No, eggs are they're an embryo of an animal, all right? So they increase cardiovascular disease risk, colon cancer, diabetes, and lethal prostate cancer significantly. Don't go there, all right? So stay away from that, real important. Another major source of saturated fat and all these fats is gonna be dairy, all right? Dairy is milk, butter, cheese, yogurt, cottage cheese, and ice cream. Cheese is the most popular source of saturated fat in the United States. Yes, all those ads, you see them on TV, they market it like crazy. The pizza commercials, the cheeseburger commercials, the cheese commercials. Oh my gosh. Now, cheese is made from the milk fat, which is about 70% fat. Oh, and it's so saturated. So I want to stay away from all these. Now, a little biochemistry. I don't want to spend time teaching you a tremendous amount of biochemistry, but you want to get the message here. These are 4 different fat molecules. Now, this is relevant to cholesterol for a very specific reason. Now, on the bottom, well, first of all, the C represents the carbon atom, the H represents the hydrogen atom, and the O represents the oxygen atom. Now, these are 4 different classifications of fat molecules, different types of fats. Not all fats are the same. So the bottom fat is what we refer to as a polyunsaturated fat. And specifically, this is alpha linolenic acid. Now, the reason it's an unsaturated fat is because it's got this very special feature. Carbon can normally attach to 4 other atoms. Each carbon can normally attach to 4 other atoms. Now, here we have a very special feature. It's a carbon-carbon double bond, which is a high energy bond. This high energy bond, our body recognizes, and we love carbon-carbon double bonds as an opportunity to actually use specific enzymes to break these open and then reconfigure and restructure these. So we look at this type of fat as like Legos. We say, oh, wow, I can make something new. I can create something new. So we can take a polyunsaturated fat. This one has got 3 carbon-carbon double bonds. So we can manufacture all kinds of things. So we use this as a building block for hormones and enzymes and proteins, all kinds of things. We use it for everything. So we use it for all kinds of structure. We will produce it in many, many different ways. So we can manipulate this one. Now, the first carbon with the double bond is the 3rd carbon from the methyl group. Okay, so 1, 2, 3. That's how we number these fats. That's why we therefore call this an omega-3 fatty acid. All right, so it's an omega-3 because omega meaning the 3rd carbon from the left, from the start, omega. All right, so that's what we do. Now, this one up here is a polyunsaturated fatty acid as well. It's linoleic acid, but it's got the first carbon-carbon double bond on the 6th carbon. So therefore we call it an omega-6 carbon. Now, this coming from animal sources actually ends up being inflammatory. So we want to make sure that our ratio of fats is predominantly omega-3s and very little from omega-6s. Now, the next fat up from there is monounsaturated fat. It's only got 1 carbon-carbon double bond. We can't do a whole lot with it. Okay, so it's an omega-9. The top fat is what we call a saturated fatty acid. All right, so it's palmitic acid from palm oil. Now, the thing is, this has no carbon-carbon double bonds. It's saturated with hydrogen. So there's nothing we can do with it except transfer it to the liver and roll it up and manufacture more cholesterol, which we don't need. Everybody got it? I hope so. All right, so we don't want this saturated fatty acid. Monounsaturated fat, pretty close kissing cousin to that too. So we don't need that. All right, this saturated fat, just so you can see, it has the same biological properties as these modified saturated fats. Did you know that these are saturated fats? They come from saturated fats? Yeah, plastic, motor oil, diesel fuel, and gasoline. Yep. Yeah. So when you're consuming saturated fat, you're doing no different than adding motor oil to your diet. That's really not a good idea. So don't do that. The third recommendation is to go plant-based in your diets. So we really want to be able to do that. It's really important for a lot of reasons. I just list a few here. All right. First of all, a fast food meal has an average of about 42 grams of fat, and a lot of it is animal fat and saturated fat. Whereas a plant-based meal has an average of only 1.3 grams of fat, incredibly low in terms of fat. Vegetable protein also helps reduce the risk of chronic diseases in many different ways. And we get the fiber, really important because of the fiber in plant-based foods. It helps to reduce cholesterol production by the liver. It really does. It makes a huge difference. And we also see, we've done the research on this, we see a 16 to 20% reduction of the oxidation of the LDL cholesterol, which is really problematic because when we oxidize the LDL cholesterol, we have more of those small particles, and that's much more problematic. So the antioxidant properties of plant-based foods are protective. So it's really important for us to have this dietary approach. It makes a difference. So what does a plant-based diet look like? Well, it looks like this. All right, if you want to break it down, it's legumes, beans, peas, lentils. All right, you got over 2,000 varieties. You can knock yourself out. You'll never get bored. All right, there's so many different varieties. Whole grains, not processed grains, not flour. All right, so we want whole grains. In addition, we've got starchy vegetables. Potatoes are wonderful. The Incas developed over 4,000 varieties of potatoes. They were the originators of the potatoes. And then squashes, sweet potatoes, all fantastic source of healthy food, healthy plant food. And then vegetables loaded with antioxidants, really, really great for us. Eat the colors of the rainbow. In case you forgot what they look like, I thought I'd show you a picture. So here they are. And then fresh fruit, absolutely wonderful. Fresh fruit, not processed fruit. We're not talking about fruit juice. All right, I'm talking about fresh fruit. You can cut it, but naturally it works so much better. And it's got all the great fiber and everything else that we want. Wonderful. The benefits of this approach, including reducing your cholesterol, many, many other things. All right, stimulates the parasympathetic system, activates a thriving state, decreases hormonal stress. Yes. Gets stored as glycogen, activates the immune system, decreases inflammation. That's also very important. Activates the human growth hormone, slows aging, uses very little insulin. And there's even more. I'm not going to even read them because I'm getting tired. Okay, so the thing is, it's absolutely wonderful. And there's so many research studies that show the benefits of a whole food plant-based diet. Remember this, all right, that the food that you eat can either be the safest and most powerful form of medicine or the slowest form of poison. And it's not just the food that you eat. Remember that, okay? So it's the food that we eat, it's the thoughts that we think, the words that we speak, the actions that we take, the company we keep. I mean, all of it has an impact, and absolutely the food has an impact as well. So you have to think about this because the food that you eat, every time you're eating or drinking, you're either feeding disease or you're fighting it, and you get to choose. So my way of looking at food very simply from a neurological perspective, this is my food pyramid. So the food pyramid, it's an inverted pyramid because what we want to do is minimize the foods on the bottom. And these are all the foods that stimulate a sympathetic response in the body. So they cause inflammation, meat, dairy, oils, processed foods, or they're flat out toxic. So refined sugar, deep fried foods, all sodas, carbonated drinks, all carbonated water is going to do that. Legal drugs include caffeine, nicotine, and alcohol. And then excitotoxins include aspartame and MSG. So my recommendation is to reduce and minimize or eliminate these types of foods. Work your way up to the top of the pyramid. So we want starchy veggies, whole grains, and legumes for energy because we need to be able to produce energy. And then we need greens, colorful veggies, and fruit, because this is performance, anti-aging, and antioxidants. All right, so we need a lot of the antioxidation in our diet. It's really important. And Hippocrates said it well. I mean, he's the father of medicine. So what happened to my slide? Oh, what happened? Oh, it somehow didn't show up right. I have to find out what happened. Something happened. That's odd. I didn't know that would happen. All right, so a little bit of research. All right, a little bit of research on the therapeutic foods. What we show in the research is very fascinating, is that your LDL cholesterol. So we took people and we put them on 2 weeks of a low-fat, starch-based, vegetable-based diet. All right, and they showed over a 30% decrease in their LDL cholesterol. And it was comparable to the decrease from a statin medication as well. So which would you rather have? Something that tastes really great or a pill? All right, which would you rather have? Makes a big difference to me. We've also shown there's been some very fascinating research studies. This is just a couple of them. All right, so we actually show that there's a therapeutic effect of plant foods. Absolutely. We took some very high antioxidant food, kale and red cabbage. And what we show, cooking actually diminishes the nutritional benefit, but fresh, juiced, or steamed, any which way you want to get it, really showed a very important clinical benefit from having that in your diet. It's great. And then even avocados. I mean, avocados are delicious. I love my avocados. All right, so avocados, what we showed is that we could actually decrease the LDL, the lipoprotein particle number, size, and subclass in overweight and obese adults in a randomized controlled trial. And that was published in the Journal of the American Heart Association, 2015. I thought this was fascinating because what we showed is we took people who were overweight and obese, and on a regular diet, they had very high LDL cholesterol. So this is over 200 here. And then what happened, we put them on a plant-based diet and their LDL cholesterol came down. What was fascinating is that we put them on a plant-based diet with a little bit of avocado and their LDL cholesterol came down even more. And you would think, well, avocados have fat, but it's the protective nature of the fiber in the avocado that actually led to the decrease of the LDL. So the fiber and the fats, we have to have a certain amount of fat in our diet, but the quality of our fats needs to be from plant-based sources. And that makes such a huge difference. And what we showed there, here's what we actually did in another study. What we did is we took meat eaters, overweight and obese, on a plant-based diet, 3 sources of fat. So the full-scale aspect of that same study, excuse me. So what we did, one group, we put them on carbs as their source of fats, vegetable oils, and the third group, avocados. And what we showed is that the greatest decrease in the total LDL cholesterol was from the group that had the avocado as their source of fat. And then what we showed for the small particle in particular, is the LDL 3 and 4, that the carbs and the olive oil, negligible change, and the greatest change was with the avocado. Oh, it's so exciting. All right, so that's the food part. So now let's move to the next part, the fourth aspect that's really important. So one of the things that really affects cholesterol level is smoking. It really does affect the body tremendously. So smoking, alcohol, caffeine, all affect cholesterol because that puts the body in the sympathetic state. So if you're a smoker or if you know a smoker, definitely recommend to quit smoking. It really is imperative. I have had several of my clients over the years that were smokers, and what I did is I had them get this book, absolutely gold. Absolutely gold. Alan Carr's Easy Way to Stop Smoking. Fantastic. Everybody who has read it has quit. They've quit for good. And it really has made a powerful difference. Great, great material, great information. Another very important factor when it comes to cholesterol is physical activity. Very, very important. So yes, it increases your HDL, but it helps to decrease your total cholesterol as well. Lifestyle medicine, we recommend 30 minutes a day for 5 days a week, a total of 150 minutes a week, 150 minutes a week, 150 minutes per week, 150 minutes per week. All right, that is a major prescription. You'd be surprised how many people are not exercising. So you want to make sure that you get your exercise in. It helps in so many different ways. That is one of the most important things. And this is me on the left saying this: what fits your busy schedule better? Exercising 1 hour a day or being dead for 24 hours a day? So what's it going to be, boo-boo? All right, so you just have to really get your act together and get your exercise going. Very important. And probably the most important component when it comes to being able to address cholesterol. Yes, your food's important. Yes, everything else that we've talked about is important. There are many other things too. But you've got to be able to manage your stress. And this is really important. So we got to be more like cats and dogs. We really do. All right. If you've got a cat or a dog, you know, they sleep about 16 hours a day. Yes. All right. They're chill. All right. They are chill. So rest, meditation, yoga, massage, do whatever you need to in order to manage your stress, because most of us have far too much. When we've got too much stress in our body, our central nervous system is saying, hey, you need help. I'm going to create some more cortisol here, and I'm going to throw your hormones out of balance because you're in a state of survival. So that's what's happening. Remember, the central nervous system runs the show. It runs your body, and you don't think about it, but it's happening all the time. So we need to be able to do this, and we need to spend time being quiet. That's really important. Most people do not spend quiet time being still. There's a great book called Stillness is the Key. I'm going to write that down because I want you to get that, because it's a really good book. So stillness is the key. And you want to be able to practice meditation or stillness, but there's a very simple way to practice this. If you're not into that, that's fine. Dr. Andrew Huberman, I'm going to send you his material. He's done some fascinating research, and it's interesting. All animals do this when they sleep. So what happens is that when we're sleeping, all animals, we naturally do this process of a very particular way of breathing. So what we'll do is we inhale and exhale like normal, but then we'll inhale, pause, inhale a little bit more, and then have a long exhale. That particular pattern of breathing, Dr. Huberman has shown to be instrumental in being able to offload CO2, increase oxygen, decrease stress, and stimulate being in the parasympathetic state more deeply. Now, when we practice this consciously, it is a way to help really mitigate being in the sympathetic state and to really shift into the parasympathetic state quicker than anything else. It's the quickest way, and it's to practice this consciously. So next time you notice yourself getting irritated, frustrated, angry, annoyed, upset for whatever reason, start practicing this controlled breathing pattern. I'm going to send you the video for this. It's really great stuff. And you will be amazed what it will do. I've been coaching my youngest son this last several months. He's a collegiate swimmer at UC Santa Cruz. And so he's been home for several months because of COVID. And so I've been coaching him. And part of the training regimen is that I've been having him practice this particular breathing practice and this pattern in between his training sets. And it's been amazing to see the effect on his recovery has been beautiful. It's really been great. We've seen much better improved recovery. And because in exercise, we're intentionally creating stress. We're putting the body in the sympathetic state. And so what we want to be able to do is recover as quickly as possible. Great practice, works really well. Okay, so, and then, another thing you can do is you can listen to the sounds of the ocean. I do this every night. So I have a CD player that's going on all the time. I listen to the ocean, and it puts me in a peace of calm and really helps me to unwind from the end of the day. It's a wonderful thing, and it's a great thing to wake up to. All right, so those are some practices. Here's some more research I want to share with you from one of my dear friends, Dr. T. Colin Campbell, who wrote this absolutely amazing book, The China Study. When I first read this book, I go, wow, This is amazing. This is what we should have had as our course on nutrition when I was in medical school. This would have been amazing. And it's an incredible book. Now, when it comes to cholesterol and the impact of cholesterol in the diet, it's fascinating when we look at large scale studies. And what we see is this, that in countries where females have a plant-based diet or a predominantly plant-based diet, one of the things that happens on the female hormones is that they usually end up starting menstruating. And so what we call menarche, that usually starts around age 15 or 16. And then the hormone levels go up to about 35 on the female hormones. And then that stays at that level until about age 45. So usually we start seeing menopause at about age 45, and then the levels come back down to where they were around 10 by the time they're 50, and then level off. But in countries like the United States, in countries where they have a lot of meat, dairy, and eggs, and they have an animal-based diet, what we're seeing is that menarche is as early as age 9 or 10. It happens quite early. So the hormones, and it's not just the hormones in the food, it's having the animal-based on having all that cholesterol in the diet. So what we're seeing is that menarche starts earlier, and then the hormone levels skyrocket up to 50, and then it stays at that level for a longer period of time up till age 50. And then we start seeing menopause start to kick in around there, and it goes down, it plummets down. And this is a dramatic shift. It really is a dramatic shift at this point. Now, a couple of things from this graph. One is that we call this increased area of the female hormones, estrogen, progesterone, and luteinizing hormone, all these hormones, that increase, what we call that is the estrogen load. So we refer to that as the estrogen load, and that increased amount of estrogen is directly correlated with the increased risk of breast cancer. So we definitely see that. So it's a real serious issue. And so it's really important for us to recognize that. Another really great researcher who's done great research on heart disease is Dr. Caldwell Esselstyn. I love this man. He's just really great. And he wrote this wonderful book, Prevent and Reverse Heart Disease. Incredible clinical studies. So what he saw when he was starting off, he looked at this research of what happened in Norway over the course of about 20 years. So what happened is that the mortality rate from circulatory disease in Norway back in 1927 was about 24 people per 10,000 population. That was the rate. And then what happened, the rate continued to climb up and up and up and up until it got to about 30 people per 10,000 in 1939. Then in 1939, we started to see the rate start to gradually go down, and it plummeted down to the level that it was back in 1927. That seems odd. What happened in Norway back in 1939 that caused this dramatic shift? What happened? So it was very interesting because what happened in Norway? German army invaded Norway in 1939, World War II, beginning of World War II. They came in, they confiscated all the animals to feed the German army. Mm-hmm. And they left the Norwegians with nothing but potatoes and vegetables. That's all the Norwegians were left for eating. So they subsisted during World War II on nothing but potatoes and vegetables, and circulatory mortality plummeted over those 6 years until June 1945, and then the rate started to go back up. What happened in June of 1945? World War II ended and the animals came back. And so they started consuming the animals again. Heart disease mortality started to climb again. So Dr. Esselstyn said, okay, what if we can replicate this with people who are really sick? He was at the Cleveland Clinic and he said, all right, give me people who are on death's door and give me those people. And I want to see what's the impact. Let's do a clinical study to see the impact of putting people on the Norwegian dietary approach during World War II. Let's see if we can do that. So we took 24 people who were told, get your affairs in order, prepare to die. And 18 followed his Norwegian plan dietary approach, whole food, plant-based, oil-free, and they lived free of heart disease for over 20 years. They were told, get your affairs in order, prepare to die. 20 more years. Incredible. So he extended a warranty period to his approach of 25 years or 25,000 miles, whichever comes first. But those who did not follow, they all died in a shorter period, much shorter period of time. Now, Dr. Esselstyn, as great as this work was, he was wonderful about it. He says, this is dramatic, but people still criticize him, you know? Now, you don't criticize Dr. Esselstyn very easily. I mean, this guy is smart. He is amazing. He's an Olympic gold medalist. I mean, you don't just take shots at him any day. So they took shots at him and he said, fine, I'll do another study if you think this one's too small. So he did a second study. He started in 2010. And what he did is he took 198 patients. All right, so 8-fold increase in the number of patients. Now, 21 of them, or 11%, did not follow the plan, but 177 or 89% did follow the plan. And he published this 4 years later, so very specific. Now, the people who did not follow the plan, all right, they were not adherent. So in a 4-year period of time, these people all had previous history of cardiovascular disease, high cholesterol, blood pressure, the whole bit, right? So in 4 years' time, we had 62%, 13 of them that had repeat cardiovascular disease event, all right? Either angina, they died, had a heart attack, whatever the case may be. Now, 8 or 38% of them did not. Now, this is what we would expect. We have lots of research studies that correlate with this as well. We know that if you have a cardiovascular disease event in the next 4 years, you have a 2 out of 3 probability of having another cardiovascular disease event. So this added up. It really did. Now, the people who did follow the whole food, plant-based, oil-free, the Norwegian approach plan, those people in 4 years' time, all right, blue's good, red is bad, all right, in 4 years' time, here are the results. 99.4% of that group had no cardiovascular disease event, none. One person went on a business trip, had a greasy cheeseburger, and had angina the next day. That was the one, all right, 0.6%. Now, we have never seen any drug. No statin drug comes close to this, none whatsoever. It's ridiculous to think that anything could come close. So the medical approach really doesn't work with this, like not nearly as effective as a lifestyle change, In fact, when we compare Dr. Esselstyn's research compared to the other recurrent major cardiac events study comparison. So there were 3 other research studies, and Dr. Esselstyn's treating the cause, only 0.6 recurrent cardiovascular events. The others had 19.4, 20.4, and 25% recurrent events. So significantly better, significantly. And in fact, he even had one of his colleagues, a physician, who was told, we cannot do a bypass on you because your left anterior descending artery has got so much blockage, we can't even do a bypass. So this doctor was so depressed, and he said, oh my gosh, what am I going to do? Dr. Esselstyn said, come into my study and we'll do this. And so he went into the program 32 months on a plant-based diet. And then because he's a physician, he was able to get a repeat angiography and showed a complete reversal of the heart disease. This is conclusive evidence. It's conclusive. It's incredible. Not only that this artery is opened up, but you also see more arteries are opened up. There's greater blood flow all the way through. So one way to think of it is this, that a whole food, plant-based, oil-free, vegan approach to diet is going to keep your arteries nice and clean. We want that. A vegetarian diet still got some saturated fat from dairy, all right? So you'll have some plaque formation, you get that cholesterol being laid down. Carnivorous diet, absolutely going to get a lot more plaque. So that's going to be happening. Now, in addition, I want to show you the research that's been done by the World Health Organization. They concluded after their leading researchers, they had a good solid group of, I think, about 10 of their leading researchers, and they reviewed over 800 research studies. And they concluded that processed meats are a class 1 carcinogen, causes cancer, really causes. All right, and then all other meats are a 2A category, probably cause cancer. So animal foods really don't do us good. The response from the meat and dairy and egg industry is bologna, which happens to be a processed meat. Okay, so the thing is, there's no amount of these foods that is safe, no amount of them. They're filled with cholesterol and all kinds of other problems as well. So we have lots of research studies now that show that plant-based diets absolutely lower cholesterol. The greatest benefit on lipid levels was seen in those who followed vegan diets. All right, and so we want to be able to follow that whole food plant-based diet. This is the blood work of one of my clients, and here's what happened. It's very interesting, because when we started back in 2015, when we looked at this, his total cholesterol was 180, his HDL 56, his LDL was 98. So I said, let's go to a whole food plant-based diet. So he did. And so he went to a whole food plant-based diet. And so then his total cholesterol dropped to 155, which we look to see about lower than 150 is very good. But his HDL was good, not too bad, just a little drop, 45, but his LDL dropped a lot more, down to 82. So that was a very good drop. All right, and then he continued on this, and we see it went all the way down, total cholesterol down to 133. Yes, I was so happy and elated. It was so great. All right, so a year later, 133, HDL cholesterol 47, and LDL was 62. Fabulous, absolutely fabulous. But he didn't stick with the program. He stopped working with me, fell off the wagon for a little while, and then his cholesterol started creeping back up, 150, all right, 54 with the HDL, and the LDL started to climb back up to 79. And then he said, oh, I'm fine. He was just, I'm fine. And then he continued, a year later, and his cholesterol climbed back up to 160, and HDL of 49 and LDL cholesterol of 88. So now it's climbing back up again. So then he gives me a call and says, Ruben, I think I need some work. And so we started to work on this again in following a plant-based diet. And he wasn't even perfect at it. He's just getting better at it. He's just making progress. So his total cholesterol dropped back down to 148, less than 150, HDL cholesterol 55, and because he was getting more exercise, and his LDL dropped back down to 75. So this is just to show you that you have to be persistent. You have to be persistent on this. So the risk of heart disease, what we show in the research is that if you're a meat eater, your risk of heart disease is easily 50%. All right, and if you're a vegetarian, it doesn't get much better, but it's a little bit better. It's 45%. If you're plant-based vegan, then it's going to be 4%. It's the lowest amount of risk for heart disease is that. And I love what Dr. Michael Greger says is this, that if that's all a plant-based diet can do is reverse the #1 killer of men and women, shouldn't that be the default diet until proven otherwise? Yeah, I think so. It makes sense to me. So I've given you lots of practices for today, lots of practices, all right? So these are things to really take into account. #1, decrease your cholesterol intake. If you have it in your diet, you want to just get rid of it. All right, decrease your fat from all sources. All right, you want to be able to do that and make sure if you've got too much fat, especially the saturated fats and the monounsaturated fats, choose to go predominantly plant-based. We know that that makes the biggest difference in being able to really put in the antioxidant levels to help decrease your LDL cholesterol in particular. Daily physical activity, you've got to move, really important. It's very, very important for all of us. Stress reduction is probably the #1 thing. It really is important to be able to manage stress, especially in today's world, and to quit smoking if you do smoke. Many other factors as well. Sleep is a factor, many other sources of stress. that could be happening as well. But these are some of the major ways to get started. All right, so now a question that I have for you, and then I'll answer questions. All right, so would you like to make the rest of your life the best of your life? And I hope the answer to that is a resounding yes. All right, so imagine for a moment, if you're living your best life, what would that look like for you? Would it be like this? Would you be like these people who are just having so much fun in their life, being able to do things at the activity level? And would you want your life to really be filled with health, energy, vitality, and fun for the rest of your life? I certainly hope so. The question is this: where are you now? Are you there yet? Chances are you're not. All right, and you're not. And so the thing is, how will you get from where you are now to where you would like to be? So you need a plan. All right, how will you get there? You need a plan, but do you have a plan that's actually proven to work? Most people do not. I do, because I'm living proof of what I've actually done. All right, I have a plan, and it's no mystery. It's really no mystery. So when in 1995, when I realized that I had caused my own distress in my body and my health, I had the high blood pressure, high cholesterol, high blood sugar, and I got my act together. Now, I had been fortunate. I'd been coached by so many wonderful teachers, and I had wonderful lessons that I've learned. And I realized that I needed to make some significant changes. So I have a 4-point plan. It's no mystery. It's simple, but it's a lot of work. Okay, I'm not going to kid you about it. So my 4-point plan, number one, we must begin from within. We must do that. Einstein said, the significant problems we face cannot be solved at the same level of thinking we were at when we created them. So we have to rewire our subconscious mind, because we didn't create our problems consciously, we created them subconsciously. So that's the work that has to be done. Secondly, we need a proven strategy, because doing the same things over and over again, expecting different results, is the definition of insanity. So let's not go there. Let's use an evidence-based approach, shall we? Makes sense to me. And then we need to be intelligent in creating support and accountability, because nobody is successful by themselves. And that's why lifestyle medicine is so appealing to me, because we believe in a team approach, in a coordinated approach, and support and accountability is really important. And then fourth, we need to develop a track record of consistency, because practices become habits, and habits produce results. So that's what we have to be able to do. It's no mystery. It works. It works in sports, works in business, works in health. It works in health. So I offer several things. I just want to share this real quickly with you. I do lifestyle medicine consultations. I work with people individually. If you want to work with me one-on-one, I do this with you. And I'll send you all the forms to fill out, and then you send it back to me, and then we'll schedule a consultation. These days we do it by Zoom. It's easy to do. And then I will help you. We will design an individualized plan just for you. So you'll have a personalized lifestyle medicine plan in all the areas that are important to help you get on track to really making a difference in the quality of your lifestyle. So we'll actually do that. And then I'll also send you a follow-up email with lots of resources, recipes, videos, all kinds of things. I love giving homework. All right, so the thing is, I'll give that to you so you'll have lots of information. So that's one-on-one. This is my friend John. John is amazing. He's happy in this picture because he worked with me, and he's 75 pounds lighter in this picture, and all his blood values, including his cholesterol, were completely in the normal range, completely. So really extraordinary. I also have a group program coming up. It's fabulous. It's fabulous. This is the last time we did it in person because of COVID, but we're going to do it virtually. So this is what I do. It's a group program. It's group coaching. It's wonderful. And what we do is we spend 2 weekends, and we'll go through a very, very thorough curriculum. The first weekend we address the mindset, the thinking, the attitude, the consciousness and awareness, because I want to set you up for success like no kidding. So I want to make sure you do not sabotage yourself ever again. And then the second weekend, we go into a lot of in-depth information about everything that affects your health, and we'll do that and set that all up. So it's really good. We talk about nutrition, hydration, cardiovascular, exercise, strength, and sleep. And then I set you up to understand the nature of habits and doing goal setting in a very progressive way. And then I put you into groups. And so we're going to be in groups, and then I will coach you over the course of the next 12 weeks after these 2 weekends. There is no lifestyle medicine immersion program that is as transformational as mine. It is the absolutely most transformational program. And people produce amazing results in this program. Here's just one example. This is one of my students, Donna. Donna is amazing. She's a retired nurse. In April 2018, she came into the program. She said, Ruben, I've been plant-based for 8 years already, and still I have issues with my weight, my blood pressure, and other things. I need to figure out how to do all this. So we went to work, and being in the program a few times, actually, we were able to make the dial corrections. And this is Donna. This is January of last year, and she's still looking this way. All right. She's walking like 8, 9, 10 miles a day. It's incredible. Donna is, and she will tell you, she is living her best life right now. She is absolutely thrilled, delighted, and happy, and she's living her best life. And then I also do programs for the workplace. So I was a healthcare executive, and I love being able to interact in the workplace. I also teach CEOs and executives. That's one of the things that I do. And so I love being able to bring lifestyle medicine into the workplace to transform your workplace environment. And it's awesome. It's awesome stuff. So this is information about me. I'll send you all this information. You're going to get all this. So now what I'm going to do is go to the questions. All right. So let me go to the questions. Let me go to the chat window first. All right. So let's see here. All right. I want to go to the chat window first. Let me see if I can do this. Wow. Lots of great questions. Okay. All right. All right. Let's see. Okay, let's see. All right, let's see. Some of the figures. All right, so we got people, some of the figures. All right. Okay. How can we be good citizens and care about the world and stay positive? I'm very concerned about the environment and wildlife, but as a result, see a lot that is going on today that is distressing, not always, but sometimes it brings up negative thoughts and feelings. That's a really great question. And for that, I'm going to be doing a fabulous webinar next Sunday. Thriving being vegan or plant-based in an unfriendly world. Do not miss it. It's powerful. Really great question. Thank you for that. I'm not going to dive too deeply into that, but I've got a whole webinar coming up for that. All right, let's see. I found out that I have 65% blockage of my carotid arteries. And I was told that my chances of a stroke were as bad for surgery as just leaving it as it is. A friend told me that they don't operate until it's an 85% blockage. I'm terrified of having a stroke or heart attack. Yeah, so this is why all this information is very important. So I'm so glad that you're here. So definitely, look at everything that I presented. If you want to work with me and go into more detail about what's going on, I'm happy to do that for you. We can look at that. All right, but that's why we want to look at everything. We need to look at the full scope of everything that's going on. Okay, let's see here. If you change to an oil or fat-free diet, will the blockage go away or is it there forever? Great question. So what we show, I showed you the case of Dr. Caldwell Esselstyn and his colleague who was a physician, and we did the repeat angiogram. So then we were able to see the blood vessels absolutely open up. And what we were able to see is absolutely, and the garbage trucks, the HDL are going to start to carry away all that plaque. And it's a beautiful thing. It's really quite extraordinary. So the body wants to heal itself when we give it the right environment. It really does. Okay, really great. And let's see. Okay, peanut butter versus hydrogenated. I'm assuming the oils. All right, so the thing is, peanut butter is a whole food. If you've got just organic peanuts, all right, and you get it ground up, all right, there's no hydrogenated oils in it. So it's perfectly fine as a source of fat. All right, and a little bit of that's going to be fine. But the hydrogenated oils, what they do is they take an unsaturated fat, and what they do is they add the hydrogen, so they make it more saturated. So that's the problem with hydrogenated fats, because they take those oils and they change the chemistry just so they can have a longer shelf life. Because saturated fats, if you look, plastic, motor oil, gasoline, and diesel fuel, what's the shelf life of those? Forever. All right. So pretty much. All right. Let's see. Is almond milk a better choice than milk? Absolutely. There's all these plant milks that are fabulous. These days, we've got more plant milk availability than ever before. When I started off doing this 26 years ago, there was nothing available. So today we got almond milk, hemp milk, rice milk, soy milk. I mean, we got all kinds, and knock yourself out. It's really great. Really, really. By the way, if you're smart as far as investing, invest in plant milks. All right, because the market's going up in that. Really good. All right, let's see. What about substituting Smart Balance or Earth Balance for butter? Oh, great question. If you really look and read the labels, you're going to find out that Smart Balance and Earth Balance are loaded with oil. Okay, so we want to be careful. All right. By the way, there are a lot of vegan foods that are also processed foods, and a lot of them have a lot of oil added in. So you have to be mindful. You need to read the labels. Okay, read the labels. So very, very good question. All right, let's see. I've been knocked out. I'm eating over 3 times. All right, let's see here. I don't know what. Beyond veggies, fruit, grains, and legumes, I have heard that special foods are particularly helpful to reduce cholesterol. What do you think of garlic and yogurt? Okay, so there's interesting research studies that are always going on. Certainly garlic and most vegetable foods have antioxidant properties that are really great. Yogurt, not so much, because yogurt is a dairy product, all right? So it's not going to really work very well. However, there are plant-based yogurts that you can get. So you can do that as well. All right, so we want to stay away from the yogurt. Let's see. Chocolate, green tea. Okay, so chocolate, green tea, and vitamin D increase HDL. Is this true? I'm not so sure about that. It may be. I haven't read anything on increasing the HDL. The HDL is not as significant a factor in terms of our cholesterol as the LDL when it comes to risk. So we want to really pay attention to the LDL. Okay, so how long does it take to see a significant decrease in LDL and total cholesterol using just the diet? Well, everybody's a little different. So it depends. That's my standard answer. But the thing is, what we show is that as soon as you start making the changes, the body starts to say, oh, thank you. And it starts the healing process. So it depends on how much damage has occurred, how long it's been going on, and what's your overall state, what's your inflammation state, everything else. So there's a lot of variables at stake, and every single one of us is different. But you want to start. You just want to start. Okay. So it depends. So some people, it may, in fact, in some people, we can start seeing changes that happen in just hours. All right. It just can be very quick. Others, it may be a few weeks. Others, maybe a couple of months. So it depends. All right. Let's see. How do you find out the size of your LDL particles? Well, they have advanced blood studies for that now. So you can actually do that. So it's possible to actually order those or get those blood studies done. So it's possible to get those tests done. Let's see. Yes, it's blood work. What exactly do you have to ask for? You have to ask for it. They'll look for the LDL particles. And you would actually, yes, have to ask the doctor for that order. Yep, definitely. All right, let's see. Oh, the question on mast cell activation syndrome. Okay, so here's a great question. So if you think about it, so the question comes up on mast cell inflammation. So mast cells, so what we see is in the blood, this is a very unusual situation. It doesn't happen too often, but what we see is mast cells. If we start to have these mast cells in the blood get activated, it leads to the release of antihistamines. So they're basically in response to an allergic type reaction or some kind of trigger that's going on in the blood. So what's causing that? So that's where we have to look at it from a lifestyle perspective and looking to see what's causing this sympathetic response from your blood. And so we have to look at it from, to me, I look at it from a lifestyle perspective. Let's look at everything that's going on in your life that could be contributing to this, because that could definitely be contributing to the cholesterol response. Because remember, the cholesterol is going to be an indicator light to something going on. What's causing the inflammation that needs the body, that therefore requires the body to produce more of the LDL cholesterol. So that's one of the things that we want to look at is what's causing this. So that's what happens. So there's all kinds of things that can happen, like a stress. Okay. So all kinds of things. Yeah, definitely call me later, and then definitely let's set up a time to talk. That would be really great. Now, olive oil should definitely not have. I would recommend that you not have the olive oil. You eat 6 pounds of vegetables a day and about 3 to 4 cups of legumes. Fabulous, fabulous. All right. I mean, look, our cousins, the gorillas, eat 50 pounds to 60 pounds of plant food a day. So you're doing great. You're doing great. All right, but let's talk another time. Let's set that up. All right, let's see. Need a good doctor to do the test. Yes, let's see. Okay, let's see. All right. All right, let's see there. I have been whole food, plant-based for 2 years. My cholesterol is okay, but had no big changes. Triglycerides are still high, 245. I'm so disappointed, but don't know what else to do to help myself. Any suggestions? Well, hopefully we talked about enough of the food and the dietary approach that you got some ideas. I'm hoping that you got that as far as that's concerned, because triglycerides usually going up, the first place I look is processed foods. So I want to look at that. That's usually one of the things that I look at. There's many other things that could be contributing as well, but we want to look at the processed foods first and foremost. So I want to check that out. So that's one thing to look at. Let's see. Okay. I have an LDL of 114 after over a decade of being vegan with very limited oils. Are there particular foods beyond the categories of vegetables, fruits, legumes, grains, nuts, and seeds to help reduce the LDL? Well, I hope I got you some information. So the kale, we talked about the research studies with the kale and the cabbage, and even the avocados can be helpful. There's many other research studies as well. So there's a lot of things. I'm going to send you a ton of information. Dr. Greger's got some great videos on his website, nutritionfacts.org, that are really great about that. So all plant food, especially the plant food that has the highest amount of antioxidants, are very important to help reduce LDL, because that's what we want to be able to do. Okay, so let's see. Help reduce cholesterol. Is it true that a diet-based stannis and sterols will help reduce cholesterol? I don't think so, but it's a very interesting concept. But adding cholesterol, adding sterols, plant sterols, it will help. Okay, so, okay, I'm getting the question now. All right, so hold on, I'm rereading it again. So a diet that has stannis and sterols, plant-based stannis and sterols, will help reduce cholesterol. Absolutely, but there's other things too. Okay, so it's also the antioxidants that we want to look at. So there's a lot of factors that are going on. Absolutely, yes. Okay, plant-based stannis and sterols will help. Absolutely, that's why a plant-based diet is very helpful. Okay, so I thought the size of the particles was genetic, but you seem to indicate behavior can change the size of your body makes. Can you discuss this? I'll share with you the research that we've shown as far as being able to actually make a difference in terms of the size, the amount of the LDL small particles in particular, which are problematic, based on the dietary factors. So that's definitely very exciting information. So that's what's happening with that. Okay, let me go to the next question. Can dental problems cause inflammation and affect cholesterol? Very good question. The answer is absolutely yes. In fact, it's very interesting because I've talked with my dentist because my dentist actually is very, very knowledgeable about health and promoting health. And he's always talking about how he can tell when people have inflammation going on in their body because he can see it in their teeth, in their mouth. So dental problems are oftentimes an indicator that there's inflammation going on, especially bleeding gums and periodontitis, perioditis. So there's all kinds of things. So it's all those things are indicator lights of things that are going on in the body as well. And it's not uncommon. And people who have what I call inflammatory diets will have inflammation in their mouth. And the dentist and I were having a very, very interesting conversation about this because we can see it. And it's very important. And I met a dental hygienist who was really adamant about teaching people how to be plant-based. And in fact, that's a new category in lifestyle medicine, is being able to be a dental hygienist or a registered dietitian to be actually board certified. So it's very exciting. Okay, let's see. Eat olives or avocado, not oil. Also, there are fatty fruits like durian. Yes, that's true. Yep. Don't eat the oils. All right. Any other questions? Unmute yourself. I think I went through everything. I think I did. If I missed something, I apologize. I sometimes do. All right. Let's see. Other questions? Unmute yourself. Unmute yourself.
Hey, Ruben, it's Donna.
Yes, Donna.
Hi. So when you're getting just a regular lipid panel, are there things that you tend to add on to that?
Well, if you're basically healthy, I wouldn't worry so much about it. But if you're really concerned, if you want to be able to check out more things, if you got some things going on, then you can ask for a more detailed panel. So it depends on your insurance carrier in terms of how much they're going to allow you to actually ask for, and your doctor. But you'd have to ask for those things, and you need to ask for a more detailed lipid panel. You can get that. The labs are doing these studies now. They're able to do those. And they'll give it to you. Usually they'll give it to you. I hope that answers your question.
Usually they don't give it to you unless you know enough to ask for it.
Well, this is true. This is true. But you have to advocate for yourself and say, I really want to know what's going on in terms of all of these details because you've been reading some more of the research. I'm going to send you a lot more information in the email so that you can actually see for yourself what's happening in the research. And then you can have an intelligent conversation with your physician and be able to say, well, this research study shows this, and this research study shows that, and I'd like to know about this. And then they'll say, oh, I think I need to read up on this research study, and then they'll be educated, and that'll be good. So you have to help educate your physicians. It's a good thing. They're always behind. Other questions? Anything, anybody, anything at all? Anything at all? Unmute yourself. Okay.
Yes. Can you hear me?
Yes, I can hear you.
Hi, this is Robin. I had left the room, I think, when you might have addressed my issues with where I had an accident in 2002, and that's when I developed all this mast cell activation disorder and the inability I don't have enzymes that will break down fructose, maltose, so I can't eat fruits. I can't eat any starchy vegetables. I can't eat any grains. I'm limited completely to just low carb vegetables and legumes. I can eat those because it's a different type of starch. And I worked for Dr. Furman as his dietary assistant several years back. So I know quite a bit about this stuff. But then my cholesterol, I've been vegan since 2005. And my cholesterol, so I told you I had the high, my cholesterol is awfully high. And before I knew I didn't tolerate nuts, I ate nuts, but I didn't eat any olive oil or anything. So I don't know if maybe my cholesterol is high because of the accident that did something. Nobody knows what it did. I was crushed. A horse reared up and flipped over backwards on top of me and shattered my pelvis. And I had lots of internal injuries and damage to my intestine, my small intestine and bladder and all that stuff. But they can't see anything wrong with it. They can't see anything. It's just that I don't digest foods properly.
Right.
And so that's the only reason I do olive oil, is just to get calories.
I get
basically.
that. I get that.
Because all I can eat are beans and vegetables. And I eat about, 6 or 7 pounds of vegetables a day. And I have to cook them because I can't digest raw ones.
Got that.
And so I just, never know if somebody can shed any light on that. But I guess I have what would be considered an orphan disease. So,
well, you have an impact. Okay, so you had a traumatic effect, traumatic events. Okay, a really traumatic event. I mean, this is not uncommon. I've seen this many times. I mean, so when you have a traumatic event that really is quite traumatic, I mean, everything got impacted in that accident. I mean, so that was just a crushing blow, and so many things got jolted. Now, medically, they may not be able to see anything, but I promise you that the impact is there. So other kinds of modalities and therapies can help, not just lifestyle medicine, but even things like, I know this, I mean, like myofascial release therapy, like acupuncture, like many other things, craniosacral therapy. I mean, there's many other kinds
I've been doing those. Yeah.
There's so much going on here because the trauma got stored in your body from that accident. And is there an impact? Yeah, absolutely. And has it released? And no, it hasn't released completely. There's still an impact. I mean, we as human beings, we store energy from trauma, and it can be stored indefinitely. And so it has to be worked on and released. And there's so many different kinds of ways. I mean, I can think of I went through myself. I went through myofascial release. I went through craniosacral therapy. I did acupuncture. I've done all kinds of things to help me as in my own history as well. And rupturing my Achilles tendon and other things that I've had in my life. I've had to deal with it in other ways and work around that and support myself in so many different therapies. So there's a lot more to your picture here than meets the eye. And I would submit that your body, when it's traumatized, so consider this. And this is true for so many people here on this. This is such an impact. So when your body is traumatized for whatever reason, physically, emotionally, mentally, or spiritually, it's traumatized. So then it's triggered to be in the sympathetic state. Now, if it's a tremendous trauma, that energy is stored, and your body may never get fully over into the parasympathetic state because there's still energy that it's dealing with. It's never fully healed because it's dealing with that, and it's chronic and it's ongoing and it's there. It hasn't been totally healed all the way. The body wants to heal itself, but there's been so much trauma and so much damage from that it can stay in the sympathetic state at a low level for a long period of time, almost indefinitely. And I've seen
that's what I've been working on a lot. I've finally, the only things that I've done all those treatments and all those therapies. The only thing that's worked for me that's helped has been finally they put me on very low dose amitriptyline, which did help the gut a bit. It made it so I could eat because I couldn't eat at the point they were going to put a feeding tube in me. Now I'm doing low dose naltrexone, which has helped a lot. A lot. They tried to start me on some peptides. I took some peptides. These, I actually just started that today. The BPC 157, which is supposed to be amazing for restoring the gut, but it triggered my immune system. So anything that goes orally through me triggers my almost everything triggers my immune system. There's not much medication I can take, very limited on supplements I can take. And of course foods, because they trigger the so I do seem to be able to do IVs and injections because it doesn't go through. through the GI tract. But
right.
the whole food diet is why I'm alive.
Yeah, yeah.
Other not be alive. Yeah. Absolutely wouldn't.
Well, you know, this is why for so many people there are greater complexities to the issues that we face. And yes, you can have a plant-based diet, and yes, you can really follow it to the letter, and yes, still things can persist because there's more to the picture. And lifestyle medicine can really help in terms of creating that foundation. Just foundation. I mean, just think. I mean, if you weren't following this foundation, you'd be a mess.
I would not be alive. I would be underground.
Probably. So, you know, it's really great. So thank you for sharing. I mean, if you want to have a separate call with me, you know, be able to send me an email about that, and we can schedule something around that. And then that would be great. But you bring up a very, very potent example of how complicated it is, because the medical community, their answer is to give you a drug to treat a particular symptom. That's their answer. That's their training. That's all they know. Whereas lifestyle medicine, we're going to look at the total you as a being. We don't claim to have control over all of it. We're going to try to create a good foundation for you. And then there still might be things that need to be addressed that are outside of our particular wheelhouse, but there still could be more. And this is why I recommend things like, I'll never forget the time that they worked on my gut with myofascial release, and I had 4 therapists take their fists and use their whole body weight. I was lying on the they had to put me on the floor, okay, and they had to put 4 people put their fists into my gut with all their body pressure. I mean, I was writhing, until it finally released. Oh my goodness. Oh my goodness. I mean, Robin, it was incredible, but I've been completely fine ever since. It's been incredible.
I have not done my fascia release. I have not done that yet.
It's a powerful, powerful therapy. And in fact, I have a client of mine. She is a PhD. No, she is a doctor of nursing. And so she is also become a myofascial release therapist because she has seen the benefit in her own her whole life. And there are many other modalities that are out there, but that's one that I can speak from personal experience and how powerful that has been. I'm sorry.
I think I've hesitated, because how do you find a good one?
Call me.
Somebody
we'll
really
talk about
knows
it.
what they're doing.
Call me. We'll talk about it. I've got resources for you. Good. All right. Anyone else? Right. Anyone else?
Ruben, I'm Stacy from Indiana. I am a holistic nutritionist, and I'm a food for life instructor through the Physicians Committee for Responsible Medicine. And I just want to tell you, you are amazing. And I am so thankful that I came across this webinar, and I'm following you on all platforms now. And I even am interested in working with you in the future for me. So I just want to tell you, thank you so much for doing what you do. This information is so imperative, and everybody needs to know it. And you should know how amazing you are. So
thank you. Thank you, Stacy. I appreciate it. From Indiana, no less. That's wonderful. And please, so I'll make this plea to all of you, please share, because I'm out to change the world and I need your help. I can't do it by myself. My vision is seeing 1,000 people on these webinars. I would love to see that and just grow and explode from there, because I'm clear that this approach, this lifestyle medicine approach, can really change the world, change healthcare. I mean, people need their health and we need it so desperately. So Stacy, thank you for your words of acknowledgement. I so appreciate them. Thank you. So I'm going to say thank you to all of you. I appreciate you. I love you. And thank you for being here. I appreciate your time and your energy. Please share this. I will send you an email soon, and look for all that information. And if you have any questions whatsoever, just drop me an email, and I'm available for you. That's why I live. That's my purpose in life. So I'm so grateful to be able to spend this time with you. Thank you. And goodbye.